Hi, everyone. Welcome to Mental Health and Parenthood, How to Support Yourself While Supporting Your Loved One in Recovery. My name is Sabrina. I'm the program director at the Eating Disorder Foundation in Denver, Colorado, and I am very happy to welcome everybody today and to introduce our speakers. This workshop is brought to you in collaboration with the Eating Disorder Foundation and EQUIP. And so a little bit about those two organizations. The Eating Disorder Foundation was founded in 2003 in Denver with a mission to be an effective resource in the prevention and elimination of eating disorders through free and accessible education, support, and advocacy. We are a Denver-based foundation that is now very proud and lucky to be serving individuals and families on an international level. And we're grateful to be in collaboration with professionals at treatment programs such as EQUIP. EQUIP makes gold standard eating disorder care accessible to all people through family-based treatment delivered at home for lasting recovery. Created by experts in the field and people who have been there, EQUIP builds upon this model of care by providing families with a dedicated 5-person care team, which includes a therapist, a dietitian, a physician, a peer, and a family mentor. To get in touch with EQUIP, I'm going to share with you their senior community partnership senior manager. Her name is Jessica Hickman, and she's not able to be with us this evening, but she's going to be an excellent person to connect with if you have any further questions about what services EQUIP has to offer. And I'll also make sure to add in the email address to connect with the Eating Disorder Foundation if you're looking for additional support services. We are happy to help with that. Throughout the rest of the evening, I invite everybody to use the chat feature. You should be able to communicate with me as the host. And at the end, we'll save some time for some questions. If we don't get to all the questions, I will make sure to follow up when we send the recording after to everybody who has registered. And so sit back and relax. You'll have the opportunity to review this material. And one more note before I introduce our speakers, I want to thank everyone who was able to contribute a donation for tonight's workshop. This is how EDF is able to continue providing free services to the community. So thank you very much. All right, so our two speakers this evening. First, we have Tana Luo, the Director of Therapy. Tana is the Director of Therapy at EQUIP and a clinical psychologist with a Ph.D. from the University of Southern California. She completed her predoctoral and postdoctoral training at the UC San Diego Eating Disorder Center and has experience working with children, adolescents, and adults across different levels of care. During her fellowship, she received specialized training in treating pediatric eating disorders. We also have with us tonight Kevin Dunn, the senior family mentor at EQUIP. Kevin, a dad in the family mentor role at EQUIP, knows eating disorders through unwelcome, present opportunities for positive change. He leads the EQUIP men's group and supports all parents on their path. Kevin, I apologize. I feel like I messed that up a little. Maybe you can correct me. So grateful. Thank you. So grateful to have both of you here. I'm going to pass along the microphone and looking forward to learning from you both.
Awesome. Thank you so much, Sabrina. Really looking forward to speaking with you all this evening. So here's a brief overview of what we will be covering. So we'll start off by talking a little bit about how to even start the process of seeking help for a loved one if you suspect that they are struggling with an eating disorder. We'll walk through some do's and don'ts of parent self-care, so identifying some barriers to self-care and also how to address those barriers. And then finally, Kevin is going to lead us through learning the parental ABCs and the ABLE mindset. Okay, so we first want to talk a little bit about how to even start this journey. I would imagine that some of you are very early on in the process. Maybe you are considering seeking help for a child with an eating disorder, or you're someone who's already kind of far along in the process. We wanted to make sure that we're also addressing those of you who are very early on. So as a clinician, one thing that I hear quite a bit from parents is early in the process, they might have had suspicions that their child was struggling with disordered eating. So maybe they were noticing that their child was leaving a little bit more on their plate at dinner time, or sometimes not finishing their dinner or not even sitting down to dinner. Maybe their child was saying, I'm just not hungry and I've got a lot of homework to do. So there are these signs that parents tend to pick up on, but then they start to second guess themselves. Like, am I really seeing something wrong here? Am I overreacting? Am I making a big deal out of nothing? I think what complicates things is oftentimes children themselves, adolescents or young adults might assure that everything is fine. Like, nope, everything's totally fine. I'm just not feeling particularly hungry. So this can make, again, parents second guess what they're observing. We also know that eating disorders are incredibly effective at hiding themselves and producing behaviors in secret that make it really difficult for loved ones to pick up on those behaviors. There's also a condition or a symptom within the context of eating disorders that we refer to as anosognosia. And this is a term that's more widely used within the field of mental health. And this essentially refers to the idea that sometimes individuals who struggle with various mental health conditions, including eating disorders, might not even be aware that they are struggling with the disorder. So that quality or that symptom of anosognosia can also make it difficult for parents to kind of trust what they're observing. So the first tip here is to trust your intuition. So if you notice or you believe that something seems off with your child, you're noticing these behaviors that are concerning, lean into that gut intuition. If something seems off, something is probably off. So when you're at that point where you're ready to start seeking out help, it can be really helpful to look towards a variety of different resources. So we have a couple of resources listed here, but there are many, many more out there. So EDF, for example, has a family and friends support group, which can be really helpful, again, for people of all stages. So whether you're a parent very early on in supporting a loved one through recovery, or you're much later in the process, these support groups can be a wonderful resource. The Need a Parent Toolkit has a wealth of information about eating disorders, signs and symptoms, the neuroscience behind eating disorders, how to seek treatment, all of the different types of treatment that are available, navigating insurance, etc. Tons of great information. And then, of course, Feast is also a fantastic resource. Lots of educational videos, blog posts, forums. So a lot of great materials through Feast, as well as opportunities to connect with other parents who might be in your shoes. I also encourage parents to specifically attend to resources that speak to the latest the latest research rather on eating disorder treatment. We know that there are tons of treatment options out there. There are a lot of different types of interventions, a lot of different modalities of treatment, and it can be confusing to figure out what type of treatment is going to be the best fit for your child. So if as a parent, you're on top of the latest research, that will arm you with the tools and the information that you need in order to make an informed decision about treatment. So you'll be able to kind of weigh like, okay, I know that this modality has a robust research base, whereas maybe this one doesn't so much. So again, these are things that will help just arm you when it comes to making some of these difficult decisions about treatment. And finally, of course, seeking support from other parents who have navigated the eating disorder treatment world, because it can be a confusing place. It can be super helpful to have someone by your side who has that lived experience of navigating treatment. Okay, so now we're going to shift into the parental self-care tips and strategies. So first, I want to highlight some of these core skills that are needed if you're a parent helping a loved one with an eating disorder or any other mental health concern. So here we have these different skill areas: parental empowerment, self-care, and skill acquisition and development as the 3 legs on a 3-legged stool. So the idea is that if any one of these legs is shortened or if it's kicked out from under the stool becomes very wobbly and parents might find themselves spending a lot of time and energy trying to balance on this wobbly stool. But we really need all 3. Oftentimes parents tend to kick out the self-care leg, maybe because they feel like they don't have the time or the energy. Maybe there's a sense of guilt when it comes to engaging in self-care. So we often see that leg gets kicked out. We've included that here as a leg because it is so essential and critical to parents being able to effectively help their children recover. So this is just a graphic that we would like to kind of present up front so that you keep these 3 sort of pillars in mind as we move through the presentation. Okay, so a couple of parental self-care do's and don'ts. We know that it can be really tempting to place blame on yourself as a parent or to try to identify things that you may have done to contribute to the eating disorder. And in fact, back in the day, there was a line of thinking that did tend to place blame on families and parents. But we now know that parents and families do not cause eating disorders. And there's a large body of emerging research that actually highlights the role of genetics and neurobiology in the development of eating disorders. We also know that while environmental factors and stressors can play a role, so things like the thin ideal, weight bias, those sorts of things, that can play a role. They alone do not cause eating disorders. And we know that parent and family involvement is absolutely critical to recovery. And this is also why FBT, or family-based treatment, is considered to be the gold standard when it comes to eating disorder treatment in adolescents and young adults. So rather than falling into that place of self-blame, we encourage parents to practice self-compassion and to also recognize the unique strengths that you bring to the table. Oftentimes eating disorders can feel like uncharted waters, like, oh my gosh, I'm in this unfamiliar place. I have no idea what to do. And I want you to remember that you as parents already have incredible strengths and skill sets that you already bring to the table. So yes, even though the eating disorder might present a new set of strategies, there have probably been many, many times in the past where you've had to help your child through a challenging time, or you've had to help your child do something that's really difficult. So it can be helpful to think back to those times when you've had to push your child to do these really challenging things and to think about, how did I get my child to do that? Or to think about times when your child has been sick with a physical illness. What did you do to help them recover? All of those experiences and skills can be brought into eating disorder treatment. And for those of you who are in 2+ caregiver households, so let's say there are multiple caregivers involved in treatment, I think sometimes differences in parenting style can be viewed as weaknesses, but these can actually be strengths. So if 2 caregivers have different skill sets and maybe see things a little bit differently, I think this can actually be a real strength when it comes to eating disorder treatment and recovery. And as parents go through the process of treatment with the supportive providers, they can learn to creatively tap each other in and out, depending on the skills that might benefit in a particular situation. It's also very normal for some parents to want to isolate or to not let others know that your child has an eating disorder. There may be feelings of, or there might be fear about people judging you, blaming you, maybe not fully understanding what you're going through. And so it can be difficult to let people into your journey. There's a paradox here, though. So when individuals experience blame and shame, there's an urge to hide. And yet, sharing the thing that you're struggling with can actually end up reducing those feelings of blame and shame. So this is super challenging. You're kind of going against what your emotion is telling you to do. And we know that sharing and bringing people in can actually reduce those feelings of shame. We also know that eating disorder recovery takes a village, not only for the patient, so we always want to make sure that the patient or the adolescent has a village to surround them, but also for parents who are helping their child recover. So we encourage surrounding yourself with family, friends, and of course, other parents who have been there. The more a parent can feel socially connected and supported in the process, the better equipped they will be to help their child recover. It's also okay to not feel completely comfortable opening up to everyone about your child's eating disorder. I've worked with some families who feel really comfortable sharing with extended family, friends, colleagues, people from their child's school, and lots of other families who just don't feel totally ready to share with all of their circles. So you can work with your providers to identify who to let in and how you might share with them. Sometimes there might be worry about the different questions that people might ask, what comments that they might make. Are they going to judge my experience? So those are all things that you can talk about with your provider and cope ahead for. So what are some of the questions that you might anticipate people will ask, and what are some ways that you might be able to respond to those questions and comments? All right. So this ties back really well to that three-legged stool image that we discussed in the very beginning. This is all about self-care. So again, it could be tempting for a lot of parents to put 100% of themselves into treatment. However, this increases chances of parental burnout. We totally understand that a lot of parents might find it very, very difficult to carve out time for themselves. They might feel completely exhausted from the treatment process. They might feel guilty about doing something for themselves, and self-care is an absolute must. We also know that burnout can decrease a parent's ability to be effective in the fight against their child's eating disorder, which is why we really want to highlight the value of self-care here. So part of self-care means attending to your own needs and understanding and prioritizing your needs in the context of treatment for your child's eating disorder. We encourage parents to carve out a little bit of time in the day to do something for themselves. And sometimes parents need their own therapy as well, which is highly encouraged if they need it. I think oftentimes when we talk about self-care, this might conjure up images of like bubble baths and spa days and things of that nature. And while those things are great, self-care can look like a lot of different things. So maybe self-care is saying no to taking on extra responsibility at work. Maybe self-care is letting go of some other life tasks that can be let go of for a little while, like letting the dishes sit in the sink, letting some loads of laundry go unwashed, kind of letting a couple of things go that ordinarily you'd want to stay on top of. Self-care could also be reminding yourself each and every day that you're doing a great job and you're doing the best you can for your child. So giving yourself a little bit of cheerleading. I also want to pass this along to Kevin and hear a little bit about the lived experience of just what it's like to engage in self-care when you are actively engaged in treatment for your child.
Sure. Thanks, Tana. And I know everyone, Tana pronounced it self-care. It's not pronounced selfish. So it is not selfish to understand that you do have continuing needs during this challenge. And here's what it can look like. As Tana said, it doesn't have to be a bubble bath, doesn't have to be a massage or a spa day or things that at the moment may seem like there's no way that those would ever fit into the normal schedule. So they're not going to fit into this phase of treatment. What it can look like, and when I speak with caregivers, I often ask, you're currently breathing? Yes. Then let's take your breath and turn that into something that can also help calm you down. An ice pack, in conjunction with breathing, can maybe lower your heart rate or bring you to a point after a few minutes where you are able to face the next caregiving task. And the breathing aspect is just simply a long inhalation, holding for a couple seconds, then an exhalation. And you're breathing anyway. So if There is absolutely no time in your schedule for self-care. At a minimum, moving to another room or staying in the same room if needed, and just focusing on your breathing briefly and grabbing an ice pack, maybe on the forehead, back of the neck, that is self-care also. Self-care can be as simple as a 5-minute walk, just either getting outside or simply in your backyard if you need to stay on the premises. The key is it doesn't need to be complicated, and self-care is the antidote or one of the antidotes for caregiver burnout. So we want to make sure that if you have any questions about self-care, really look at what do I enjoy doing or that provides me some type of removal mentally for a few moments from the situation. It is not avoidance. It is not in any way removing yourself for long term from the challenge. It's just a brief break for you. So thanks, Tana.
And on the note about burnout, we also wanted to talk a little bit about some of these signs and symptoms of burnout. And in addition to self-care, other ways to tackle some of these symptoms of burnout, or what to do if you're noticing some of these symptoms in yourself. So one is, of course, exhaustion and fatigue. So in addition to ensuring that you're attending to your own physical needs as much as you can, so attending to your own nutritional needs, getting enough sleep, we also sometimes recommend taking brief vacations. So this doesn't mean like jetting off to Hawaii for a week, although that would be great, but sometimes giving yourself permission to unplug, even if it's for 10 minutes at a time. We know that when parents are in the fight against an eating disorder, it truly feels like a 24/7 battle where you're constantly thinking about, okay, what am I going to make for the next meal? Is my child going to eat that meal? What am I going to do if my child pushes back? It's this constant mental kind of battle that's going on in your mind. And so taking a brief vacation just means giving yourself permission to completely unplug and to not be thinking about that next meal and to really take a little bit of time just for yourself. Feelings of resentment. This can also be a sign of burnout. This is not uncommon. It's not something to be ashamed of if you are experiencing feelings of resentment towards your child. If you are noticing that, it can be helpful to remember that the eating disorder is not a part of your child. It is really separate from your child. So when you see your child engaging in these concerning, challenging behaviors, they're pushing back against you. Maybe they're speaking to you in a way that they used to not speak to you in. Maybe they're even cursing at you or yelling at you. It's not your child that is in control. The eating disorder has really taken over your child. Your child is still in there, but some of the behaviors that you're seeing are not your child. Challenges with holding firm against the eating disorder. Although this is a challenge, generally speaking, when it comes to eating disorder treatment, it can also be a sign of burnout. So if you as a parent are noticing that more and more you're kind of giving into the eating disorder, this could be an indicator that you're burned out. When you're having those types of challenges, so again, self-care is always going to be the antidote to a lot of these difficulties. But another helpful tool is thinking about what are the short and long-term consequences of accommodating to the eating disorder. We know that eating disorders can put up a really strong fight against parents. And sometimes in the moment, especially if parents are feeling burned out, it can just feel easier to kind of give in to whatever the eating disorder is negotiating for rather than continue to fight. And while that could contribute to a little bit of short-term relief, it kind of puts an end to the argument. It can, in the long run, contribute to the reinforcement of the eating disorder. The eating disorder kind of learns that it gets its way, and it ultimately may prolong this process, not only for the child who's dealing with the eating disorder, but really for the family as a whole. It can be helpful to practice how you're going to respond to the eating disorder. So we know that eating disorders are really good at pushing buttons, saying exactly the right thing to get you to cave. So if you kind of know what the eating disorder tactics are, then you can also cope ahead and prepare for how to respond when the eating disorder does flare up. Likewise, when it comes to lower distress tolerance, so if you're noticing that there are certain things that kind of emotionally activate you pretty easily, it can also be helpful to have a cope ahead plan. So like, I know that dinner times or nighttime snacks tend to be really difficult. I tend to have a really hard time tolerating my child's distress in those moments. I'm gonna come up with a plan so that I have a set of skills for myself to use when the time comes that the eating disorder fights back at nighttime snack. So maybe it's having an ice pack on hand. Maybe it's having a routine where you do a couple of deep breaths before responding to your child. So again, having that, that plan ahead of time so that you're ready to go with those in the moment skills. Okay, and then the last don't would be not getting caught up in the downs of the ups and downs in treatment. We know that treatment isn't linear. There are going to be a lot of times when it feels like things are actually getting worse. And in fact, that's a part of the process. Things kind of have to get worse sometimes before they get better. If you notice that there's an increase in distress or there's pushback from your child, it probably means you're effectively challenging the eating disorder. So as hard as this is often a sign that you're kind of doing the work. So rather, it can be helpful to zoom out and think about all the ways that your child has made progress. I hear from a lot of parents that it's difficult to zoom out and see the bigger picture because day to day, meal to meal is such a struggle. Parents are kind of there in the trenches with their child. So periodically it can be helpful to just zoom out and take a look back. Okay, where were we 3 months ago? Where were we 5 months ago? How about 8 months ago? Sometimes it can be helpful to anchor to certain like milestones or events like, oh, I remember at my child's last birthday party, they couldn't even look at the birthday cake and here they are still maybe pushing back, but they're able to take a couple of bites. So reminding yourself of all of the progress that you've made, even when it can feel like you're in a dip over the course of treatment. And then of course, also celebrating successes, no matter how small they might seem. So at Equip, we utilize this depiction quite a bit. It's what we refer to as the J curve of recovery. So the dotted line at the top is oftentimes the expectation of what treatment will look like, that treatment begins and then progress is this beautiful kind of linear process until the child is recovered. Oftentimes parents have the experience that recovery really happens in more of this J curve shape. So treatment begins, the eating disorder starts to really push back and fight back against the process. So we see this dip, but then we gradually start to come out of that dip. It's still not linear though. There are going to be ups and downs of treatment. I want to highlight the large dip that says extinction burst. So if you're in the midst of an extinction burst and you're kind of at the bottom of that curve, it might feel like, oh my gosh, we are back to the beginning because you're in this dip. But again, if you kind of zoom out and look at overall progress, then you'll kind of see like, yes, we're in a little bit of a dip right now, but overall we're still on track and we've come a really long way from where we were initially. And if you stick out that extinction burst, you come out on the other end and you kind of keep moving forward. So again, this is one of my favorite graphics that we have because I think it really shows that treatment is not linear and the ups and downs are just a part of the process.
Fantastic. Thank you, Tana. I want to talk a little bit. First of all, thank you so much for your attention. And it's an absolute pleasure to be here and talk about these ideas and engage in this discussion. So I want to talk a little bit about the ABCs and an ABLE mindset. The parental ABCs and the ABLE mindset, let me just define those quickly for you. ABC is always be curious. Now it sounds very simplistic, but when you're curious and you remain so, it's very difficult to be judgmental and to jump to conclusions. When you're always curious throughout all phases of treatment, you become a very adept observer of what is being presented to you, both by providers and by your loved one and by another caregiver. So always be curious. The ABLE mindset goes along with that, and that is always be learning from emotions. Emotions are a valid form of communication. Often, sometimes, maybe, we may think of emotions as overreactions or things that represent maybe immaturity, if we consider them overreactions. And truly, emotions are valid forms of communications. They're neither overreactions nor signs of immaturity. They are valid forms of communication. And if we take on a mindset where we're always going to learn from emotions that are expressed to us and from our own emotion that we see bubbling up and being expressed, if we put on that mindset that we will always learn from that, we become better observers of our loved one, other caregivers, and of ourselves. And we improve our capability to be effective caregivers. So that's the ABCs and the ABLE mindset, and we're going to discuss those a little bit more in just a couple minutes. Before we maybe on the last slide, thank you, Paige. Your competencies that you currently, your skills, let's call them, these are possibly your abilities and behaviors that you don't give yourself recognition for being skills, when in fact they are. Taking a bit of a inventory of those skills is important in the beginning of any treatment process or as you're seeking information. What do you do well? And what does, if there is another caregiver in the scenario, how does that person contribute? And how do you complement one another? Your skill gaps are not the absence of skills necessarily. Your skill gaps, you may have these capabilities, or you may bring them on board, or simply recognize that you do have them, but a gap would indicate that you have not overlearned them to the point where that when called upon under duress, under stress, they are simply mechanical at that point. They are very natural to use as a means of coping or as a means of moving through the distress. So a gap would indicate more learning and practice during the good times are necessary so that you can call upon these skills when there is a lot of stress. We already talked a little bit about emotions, what they are and what they are not. I want you to, as parents, caregivers, remain open to a primary DBT polarity, dialectical behavior therapy. And that primary polarity is that we're okay as we are as caregivers. And we come to this challenge in different phases of life. We're okay, as are our loved ones and our other caregivers. But the polarity presents itself, and we must recognize the need to change, to bring new skills on board in order to effectively move forward. So we're okay as we are, and we need to change in some aspects. Seeking hope, the verb form of hope, as caregivers, we often, we want hope. Somebody please give us some hope. And I would like to urge that that is a productive way to move forward, but to add to that productivity, actually doing work, the verb form is a way to find hope along the way. What is that work? It's gathering resources. It's learning from other caregivers, from clinicians, from providers, taking on skills and practicing them. So the last item here, gathering, overlearning, and implementing skills. If you bring the theoretical knowledge of a skill on board, it doesn't mean that it's ready to be deployed when there is stress that's related to a caregiving task. So we want to practice, as I mentioned, during the good times. So let's look at the 4 phases of change. And why? Because there's a polarity at play here. We're good as we are, but we also need to change. We need to recognize that in order to be even more effective as caregivers than we already are. So the 4 phases are, the first phase is denial. And in denial, what you will find is that there's avoidance at play. There's fear and possibility of escape. What I mean by fear is maybe when we've recognized or observed, I shouldn't say recognized, observed that maybe things are not as they used to be, we try to often implement a fix. And when that fix doesn't work based on our previous experience of implementing fixes, we become fearful, because do we have the capability to actually address this challenge? And this all plays into denial. When we have that fear, we often want to avoid the problem. We often want to escape from it. And really, we're denying the fact that this is something that needs to be addressed. Now, in these 4 quadrants that I'm about to talk about, I don't want to intimate that quadrant 4 represents complete recovery, or that quadrant 4 represents a phase of treatment. What I want to have you understand is that quadrant 4 represents a commitment to change. So we're looking at, as you see these axes, effectiveness over time. So our change as caregivers is going to relate to how our effectiveness improves or decreases over time. So the next quadrant is resistance. And you don't necessarily stay in each of these quadrants for a prescribed period of time. Many move through the quadrants quite quickly, others do not. But in general, these quadrants do represent aspects and phases of change. So moving on from denial to resistance, we see often fear from caregivers developing into that anger I spoke about earlier. The fix didn't work, and prior life experience tells me that in a challenge like this, I should do this, and that didn't work. So there's also frustration there. And as long as we're on the Western side of the center axis, I want to really give a plug for skills here prior to us getting to the 3rd quadrant, because when you're in denial, or you're resisting change, or resisting there being the presence of a challenge within your family, the use of skills is very inefficient, and I would argue maybe even ineffective. So learning skills in these stages can be effective, at least having the knowledge presented to you, bringing that on board. But I would argue that the application of skills is probably much less efficient here than when you move on to quadrant 3. And how do you move on to quadrant 3? You move on through parental empowerment. And we've talked about the 3-legged stool earlier on. Tana mentioned that. And parental empowerment is the understanding that you can move forward and you can cross this center axis and seek resources, learning, and support. This quadrant is all about exploration. And I would argue that anyone on this call observing this session this evening is in quadrant 3, because this is all about how you gather your village, whether that be information or people, in order to help you in this challenge. So you have effectively moved through denial and resistance, and you're in the exploration phase. Can you ever bring avoidance, fear, escape, anger, and frustration with you into the exploration phase? Yes, you can. And when you look at the sign in the middle there labeled burnout, that is like a cyclical, it's a spinning top, that when we enter into the burnout cycle, we accelerate our own demise. And demise, what I mean is you actually fall down on your axis. In burnout, what you would see is your effectiveness drop on that center axis and just sit there as time passes. So you fall back on your axis, and the parental empowerment bridge is something that you can cross back and forth. It does happen. That doesn't represent failure. It's learning. You're gathering data, and it is a fluid boundary. You cannot feel empowered at all moments during this caregiving journey. So there's understandably periods where you are resistant to maybe change and provider recommendations, or when you find information that may cause you a bit of a setback in terms of your motivation, or you observe something from your loved one. So, but staying away from burnout is something we've spoken about a couple of times here, and self-care is integral to staying away from burnout. So I'd like to take a look at the final quadrant, and that is commitment, acceptance. Now remember, it's commitment to change being inevitable and our need to change and, let's say, improve in our caregiving efforts, and accepting that this is going to be a reiterative process. If we remain on the eastern side of that middle axis in exploration and commitment, we're much more effective and efficient at utilizing skills. So you can see here, sitting on the horizontal axis, the ABC, always be curious, and ABLE, always be learning from emotions. Those are ways, when we keep those in mind as we're observing our loved one who's enduring this challenge, these are ways that we can move fluidly between exploration and commitment to change. And this is a good boundary to be fluid within, because there will always be new resources, new people that you can access for information. And being in the commitment quadrant doesn't mean that you relinquish all of those resources. You gather them and you bring them with you. But you also want to be a very keen observer of the situation that you're encountering, always being curious and always be learning from emotions. So I talked a little bit about skills, how they're very efficiently and effectively utilized within quadrant 3 and quadrant 4. I'd like to move on and take a look at some of those skills that I mentioned. And I would ask Tana, please just jump in as we're going through these if you have some additional thoughts to add. These are key skills for supporting yourself while supporting your loved one. Radical acceptance. I'll just touch on each bubble very briefly. What is radical acceptance? I'll try to make them very much in a nutshell format. It is what it is. That is how facing reality within an eating disorder challenge is most efficiently navigated. So it is what it is not a weak response to the reality you're facing. It's actually coming from a position of strength. You're able to save your energy that would typically be utilized in fighting reality. I can't stand this. I can't stand to see my loved ones suffer. This is a horrible time for this to happen. And all the things that we do to fight the current reality are energy draining. Stepping back slightly, either metaphorically or physically, stepping back so we can gain some space and we can become better problem solvers, accepting the reality. This is what it is at the moment. I can become a better problem solver by utilizing my energy, not on fighting, but on accepting and moving forward. Validation is something that is just such a key skill. It is being with someone and having them understand that you're there with them more than just physically. So that's my nutshell description of it. However, it looks something like this in context. In a conversation with your loved one, I'm not able to do this. I can't do that. We would respond in a validating manner. I can see that this is a challenge for you. I'm right here with you and I'm going to be here. So that's a very simplistic validation, but the concept here is when an emotion or words are expressed to us, being validating means understanding we may not necessarily agree with what's being expressed, nor that the emotion is necessarily how we would express a communication, but we need to recognize that that communication is valid and we need to validate it. A person who's validated, when Tana mentioned extinction bursts earlier, typically in a communication scenario, if we don't respond with a valid answer to a communication, typically the communication frequency or intensity will escalate. So when you see emotion being expressed either in words or actions by your loved one who's enduring this challenge, validating where they are can help bring down that intensity. Okay, distress tolerance. Distress tolerance means exactly what it says, which is tolerating distress rather than trying to suppress it. Distress that's pushed under the rug because we're unable to face it in the moment is distress that will come out again another day. And I'm not saying that facing it in the moment one time will eradicate it, but I'm saying that is the beginning of the journey of understanding that during treatment, as Tana mentioned, you may see distress going skyward. And there might be the inclination to say, treatment's not working. Distress is increasing. That's not an indication that it's not working. That's an indication that the eating disorder thoughts and or behaviors have been effectively targeted. So understanding that comforting an individual in that situation as distress increases is important, but it doesn't mean in the moment removing that distress. So the compassionate response would be understanding distress will increase and we're going to tolerate it. I'm going to show my loved one that I will be here with them and the distress will not make either of us crumble. We will move forward. And that's a good modeling experience for your loved one also, to see that you can tolerate the distress. Self-care, we've spoken about, and again, it's not selfish, it's self-care. Wise mind. Sometimes we get a lock on a way of responding to things that occur, and we may be either emotional in those moments or just very rational and logical. Wise mind is, let's call it the synthesis of both the emotion mind and the rational mind. So when you're speaking with your loved one who may be enduring a challenge, and of course you've validated already, wise mind would look maybe something like this. I'm curious, tell me more about what you're experiencing. I'm right here with you. Where an emotional response to maybe some dysregulation that we may be seeing or an emotion that's presented to us, an emotional response may match the intensity of the emotion that's coming at us. And you would have to gauge whether or not in that particular situation it's effective. It can be in some situations, if you can then bring your intensity down. But the logical response may be something that you're locked into in terms of not recognizing the importance of emotion and the fact that many communications are coming at you in an emotional manner. So the synthesis of those two, if we're always trying to find wise mind, we're on our way to being the best caregiver we can be. And coping ahead is the final skill that I wanted to mention. And it's looking ahead, yes, concentrating on each individual meal, one meal at a time, is very important. There's also a risk management aspect to caregiving, and it is about looking ahead and placing yourself in situations, metaphorically, and deciding as situations present themselves to you that may be very stressful, either for yourself or for your loved one, what skills can you call upon during those moments? So coping ahead is it's a planning skill, which it doesn't really allow time for you to say, well, I'm just going to wing it. We'll see how it goes. The intent is to make you effective and efficient. And so therefore, thinking about what could come in the future, say it's a holiday party, and maybe food talk might be quite triggering for your loved one. How will that situation be faced? And that's what coping ahead is all about, so that we can think ahead and have at the ready those skills that are necessary to implement. And key takeaways from maybe the latter portion regarding skills are that an empowered parent is an effective parent. And that empowerment, as we saw the bridge from quadrant 2 to 3, really is strengthened by the resources that we gather, by the support systems that we put in place, by the learning that we do, by the skills that we bring on board. Knowledge is power. And it's not about power, it's about being an effective caregiver. But the term knowledge is power applies. We're not trying to be more powerful, we're trying to be more effective as caregivers. And we talked a little bit about this, and Tana mentioned it. Self-care is an antidote to burnout. Not the only one. However, it's vital. And I know it sounds in the beginning, how would I possibly carve out time for self-care? But it's very important. And avoiding burnout is something that closes the door on that axis. When we're in exploration quadrant, if we can close off that door to burnout, we stop ourselves from going back towards anger, frustration, avoidance, fear. And the parental ABC and the ABLE mindset are passwords to increased effectiveness. They're not the key, but they are passwords that can help us commit to change and understand that these are two skills that are vital. Always being curious and always be learning from emotions. And that learning those two skills and practicing them in your next interaction, either with a fellow caregiver or your loved one, are helpful tools to bring you into that commitment to change. Because we all need to improve a little bit in this caregiving journey, which is always changing. And some additional resources. The Equip email is there, join@equip.health or 855-387-4378, and seeing patients 6 to 24. And the links for the Eating Disorder Foundation's weekly support groups is available to you. The NEDA's NEDA Parent Toolkit and the FEAST website. And I'm a big proponent of FEAST as a storehouse for all kinds of terrific resources. If you're not familiar, it's feasted.org, and I highly recommend visiting.
Kevin, thank you so much. And Tana, I do have a few questions, so I'm just going to hop right in. And I do want to let everyone know that those resources on that last slide, I will make sure those links are in the follow-up email with the recording. So you'll have plenty of opportunities to find these resources that have been brought up today. So we did have some families observing tonight. You know, they're really taking their first steps, and I just want to share that there has been a lot of validation as well, just going over this to share that, you know, individual families aren't in this by themselves. These skills and these resources aren't really brought to our attention until we need them. So I'm glad that everybody is here this evening to kind of learn and get support and lean on one another. We're meant to do this as a community and together. So Tana and Kevin, can you both give some response to a family who is taking their first steps in this journey of recovery? Their 13-year-old is struggling and yet having a hard time kind of recognizing that this is a serious issue and, you know, has consequences. So as a parent, how can what might you advise right now, in addition to reaching out for support? What can a family do in the moment with their adolescent who is really saying, you know, I've got this under control. This really isn't a problem.
I'd like to refer back to the process of change, and then I'd like to have Tana also mention, if she would like to. The denial of the challenge leaves you in a position of not being as effective as you could be. So there is absolutely nothing lost in seeking resources as you're doing tonight. And automatically that sends you to the third quadrant, and you're on your way to understanding that I can take a look at another viewpoint. I can observe what I'm seeing in my household and understand that I do want to support change. Something is leading me to seek resources. There must be something that I'm observing that is, I need to help. So right away, denial and resistance leave you in a very vulnerable position because they prevent you from accessing the skills and the resources that may help give you a broader picture of what is available to me. And that's from my perspective, I think it's a great question to represent where we need to go as caregivers in terms of change.
Yeah, I absolutely love this question. I think it's something that families deal with often, like their child does not recognize the severity of the eating disorder. They're not able to kind of come to terms with the fact that they need help. I think oftentimes parents might have the urge to get their child to buy in, like to help their child increase insight into the eating disorder to get that motivation to help themselves. Unfortunately, when a child, an adolescent, a young adult, really anyone with an eating disorder, when they are malnourished, cognitively, they're just not going to be able to take in that information. I've worked with patients who have actually experienced some of the serious medical consequences of eating disorders. And even after having that firsthand experience, they might not be bought into the process. With all of that being said, it's not a blanket statement that reasoning and getting buy-in won't be effective. I think in some cases it can, but by and large, what I found with a lot of families is going the route of trying to increase the child's insight and to get their buy-in, usually it isn't super effective. So what we can do is arm the child with their own distress tolerance skills, because we know that eating is very difficult. Challenging the eating disorder thoughts is very difficult. So we certainly want to arm them with those tools. And we encourage parents to kind of hold firm. So if parents kind of know, like, my child's got to sit down and eat this plate of food, it doesn't really matter what the child is saying back, whether they want to do it, whether they're bought in. It's a non-negotiable that they have to finish their plate. So I just want to validate that this is something that it comes up a lot, this kind of desire to get that buy-in from the child, and again, to have that insight. The cruel paradox is that as the child actually starts to recover and weight restore, that insight will start to come back, but the insight usually doesn't come first, unfortunately.
Thank you both for responding. I know how challenging this can feel, but this is, I want to refer back to coming to support groups and hearing from other parents when we're wanting so desperately for our loved one to have some of the insight and concern that we have, because that's really challenging to hold all by ourselves. Okay, I have another question. At what point do teenagers with eating disorders need to go to residential? And is residential a requirement? That's an excellent question. Tana, can you please respond to that?
Yeah, so I think that there are certainly times when residential might be recommended. So if an adolescent is engaging in unsafe behaviors at home, so let's say there's really serious SI, self-harming behaviors, and the family doesn't think that they can provide the adequate level of containment to contain those behaviors and also work on the eating disorder, then by all means, we might recommend a higher level of care. With that being said, FBT, or family-based treatment, again, is the gold standard when it comes to eating disorder treatment. And that is an outpatient, it's an outpatient model of treatment, and it really leans on parents to do this work at home. The benefits of keeping a child at home out of residential are that it keeps the child kind of engaged with their life. I think what I've often heard from patients who have been at higher levels of care is that they kind of fall into this treatment bubble. Treatment feels really safe. They just have to focus on one thing. They don't have to deal with school, their friends, relationships, with stressful work dynamics, it becomes this really almost like an inadvertently reinforcing environment. Whereas if an adolescent is at home, they do have to face those stressors, which can be difficult, and it provides them with the exposure to cope with all of those things that come up in their sort of day-to-day lives. The other thing too is when adolescents are at home with their families, they're also able to potentially continue to attend school, continue to see their friends, and really access their life worth living outside of the eating disorder, which is so incredibly important when it comes to eating disorder recovery. We don't want adolescents to be cut off from their lives. We want them to be actively engaging. And so I guess in a nutshell, yes, residential absolutely has a place for some patients, and this work can 100% be done at home with an outpatient team.
Thank you so much. That was very eloquently said. We are at our hour mark, so I just want to take this opportunity to thank Kevin and Tana one last time for being the experts at Equip to share such beneficial information for families. Thank you all so much for your dedication, and that self-care. We'll hopefully take that as a final message. Thank you so much, everyone.
Thank you, Sabrina. Thank you all.
Thanks, everyone.
Good night.